Hi there, this is Anna Dolopo with Elements in Harmony Acupuncture.com. Thank you for reaching out to us here. There are 3 practitioners here. Myself, I'm board certified and licensed acupuncturist. This is my 24th year in practice. It is 2022, July 14. I started practice in 1999. I have 2 other doctors who work here, Dr. Hope Lin and also Dr. Shore Omidi. You can check out who those doctors are if you go to Elements in Harmony Acupuncture.com and you go to the top and it says 4 patients. It says address, Dr. Hope Lin and Dr. Shore Omidi, and we are excited to have them here. So thank you for reaching out to me regarding fertility. I do request that you go over the work for at least a week, minimum 3 to 5 days, but about a week to really understand the commitment required to work here with me as a fertility specialist. The other 2, not that I know of, specialize in fertility, but they're excellent doctors of Chinese Eastern medicine. The reason why I have you do this research regarding my work is because myself, I'm going to speak for myself, not for Dr. Lin, not for Dr. Omidi. I've been making babies since 1999. The website you see, Elements in Harmony Acupuncture.com, those are just some of the babies. That's my 3rd website. There are 2 other websites that I had previously that I'm still putting out, transferring the testimonials. I've made a lot of babies. I myself had a baby at 30, 36, and 43. They were all conceived naturally. It took a lot of work. I was doing acupuncture and herbs 1 to 5 times a week, receiving acupuncture since I was 20. I am now 48 years old, 48 years young. And I'm proud to say that all of my babies were conceived naturally, despite having been told that I might have conception issues. I'm having you go through this information so that you understand that it's not just the mommy that needs to come in. Daddy needs to come in at least 4 times a month. I'm just going to refer to my notes on what exactly needs to be shared. You'll be doing herbs. Anywhere between 2 to 6 cycles, we're going to start doing herbs. If you go to Elements in Harmony Acupuncture.com and you go to the fertility, pregnancy, birth, you'll see the recommendations for natural, IUI, and IVF. That's important to understand. I also sent you this information. If you're doing natural, I request 6 to 12 cycles, 12 to 18 cycles, or 2 to 3 years. I've done over 60 women's health videos, most of them on fertility. So I'll leave you to watch those other videos to really understand. You'll be watching those videos, 1 to 3 videos a day until you give birth. If you're doing IVF and IUI, IVF or IUI, I request that you work with me for at least 6 months, twice a week. Twice a week for at least 6 months. There's no going around it. If you get pregnant before then, great. But if you don't do my protocol, I'm just going to say you didn't follow the protocol. Those women who did 3 times a week for 3 months, lower success rate. My job is to set you up for success. You have to do Qigong with me, whether you do natural, IUI, or IVF. Qigong with me at the beach. Really fun. It is a paid class. It is fun. And it's 1 or 2 Sundays a month. I don't keep fertility clients if they do not do Qigong with me at the beach. It's a lot of fun, and you really have to understand this commitment required for making a baby. And if you're too busy to go to the beach, you're probably too busy to make a baby. This is really important. I have activities for my mommies to do every day. Writing. There's going to be moxibustion. You're going to be having fun activities with your husband. So, let's see. Daddy needs to come in 4 times a month. If you are a lesbian, supporting mommy has to come in 4 times a month. I do not deviate from that. They're writing and different assignments daily. Acupuncture. There's so many times you have to come per week. Herbs, moxibustion at home, and the most positive attitude ever. And never say the word trying to conceive. I'm not all about that. I'm about conceiving, making a baby. I don't base my success on pregnancies with fertility on positive pregnancies. I base my success since 1999 on live births. I never had a miscarriage. I did videos on preventing miscarriages. I've done a lot of videos. The most important video you might want to watch for this year, especially 2022, is Making a Baby Takes Commitment. All my information is on my website. They're also on my YouTube channel. Please do review my work. If this is too much, I strongly recommend that you see another acupuncturist with less criteria, a lot more relaxed for you, with no expectations. If you're just at that point where you really want to make a baby, whether it's natural IUI or IVF, I'm the perfect practitioner for you. I accept the most challenging cases because I'm all in, and I have a tremendous success rate. Those systems work. Systems work. When people do not follow the system, I'm not God. I don't have a 100% success rate, but I can tell you, I see what works and I see what doesn't work. And if you decide to hire me, you're about to spend money, time, and energy here, and a lot of patience. If daddy doesn't come here and you get frustrated, I'm going to tell you daddy's not here. If you're coming and you're not doing the Qigong, I'm going to say you need to do the Qigong. I have left no stone unturned. I want to make sure that you understand that I'm on your side, but it takes, two to tango, you and your husband, if we're doing this natural way. If we're doing IUI or IVF, there's a lot of work involved. You'll see the commitment required on my website. So now that I'm entering my 24th year in practice, I've decided finally to make an introduction video for any potential fertility clients. So okay, we're about to embark on this. So you don't come in and say, I'm not, daddy doesn't say, I'm not ready to do this. This is not my priority. If you're over 35 and you don't have a baby yet and you really want to make a baby, both mommy and daddy have to be on board. If you're under 35, you can do whatever you want, but I still strongly recommend that you follow the protocol. But if you are both over 35, you have to follow the protocol. I need the sperm more than I need the egg. I need both on board. And I'm at a place, I'm 48, and I've been making babies for over 2 decades, and I see what works and I see what doesn't work. So if you've had miscarriages, if you don't want a miscarriage, if you want to be healthier, if you want to feel calmer, if you need to make some changes in your life in order to create a baby, and you want that picture at 48 years old where you have 3 children. I had my children are 18, 12, and 4. I'm 48. My son was born when I was 43. Those were natural conceptions. If you want that picture, you need to make some changes in your life. If you want things in your life to change, you have to change things in your life. Okay, so I hope that really it either inspires you to work with me or helps you decide I'm too much and this is not the route you want to go. Better to know now before you decide to work with me, because I'm all in. All right? You just have to decide for yourself how much you want to make this baby and how much you want to make this baby with me. I don't do the word try. I'm not going to try. I'm going to give it my best effort, and you will give it your best effort, and you will make a baby, not try to make a baby. Jedis don't do. Jedis don't try. Jedis do. I have a high-level athlete here, and I'm treating him right now as a professional, and he came in with a book 2 days after I asked him to get it. And I was like, wow. And that's why he is where he is. He's a professional. And he said, sleepers get nothing but a dream. So, do you want to dream about having a baby, or do you want to have a baby? All right? Listen to people who have what you want and have been where you are. So, I'm all in. You just have to ask yourself if you are too, here at Elements in Harmony, Acupuncture, and Chinese Herbs. Take care.